Give the call to the Leader of the Nationals.
Thank you, Mr Speaker. My question is to the Minister for Health. In the gallery today is Jovan Rhodes, pharmacist from Nowra, along with 70 other concerned pharmacists from around the country. Hundreds of regional pharmacies like Mrs Rhodes face potential bankruptcy because of Labor's new 60-day dispensing policy. Will the government enter into a new agreement with pharmacists before this policy commences so that cost of living relief can be delivered without the risk of bankrupting community pharmacies?
I give the order. The member for Riverina. The Minister will resume his seat. Order. The member for Macarthur is warned. The member for Riverina will cool his jets. Order. I want to hear the answer in silence. I give the call to the Minister for Health and Aged Care.
Well, thank you, Mr Speaker, and I welcome the pharmacists in the gallery here and the work that they do and the work that they did all through particularly the pandemic. They were the most accessible health service in almost all of our communities through 3 years. But I welcome a question about our commitment to cheaper. I welcome a question on our commitment to cheaper medicines. We are delivering on our commitment to make medicines cheaper for all Australians at a time of cost of living pressures hitting all people in Australia, particularly people who are relying upon medicines, not just for 1 month because they have an infectious disease, but those patients who have chronic disease, patients who are on medicines for years and years, if not decades. But there is more to do, Mr Speaker. Although we have a strong record of cutting the price of medicines in just 12 months, there is more to do. So we did accept the advice of the Pharmaceutical Benefits Advisory Committee that there could be 60 days of supply for 300 common medicines prescribed for chronic disease. And that is not new advice, because the former government received that advice 5 years ago about common medicines for chronic disease. And they decided in their wisdom,
the Minister for Infrastructure will cease interjecting. The Health Minister will just pause. It's far too much noise. The member for Page is now on a warning. The warnings won't be issued if that level of noise continues. I want to hear from the Leader of the Nationals.
Well, relevance, Mr Speaker. Relevance, Mr Speaker. This is about a renegotiation agreement because this minister is taking 158...
Resume your seat. Resume your seat. Resume your seat. Resume your seat. The Leader of the Nationals has abused the standing orders. The order. The question was about the changes that the government is making. The minister is being relevant. I'm listening to him carefully about the impact of these changes. Whoever is yawning there can just remain silent. Order. Oh, the Deputy Leader of the Opposition. The House will come to order so the minister can be heard in silence. He has the call.
Thank you, Speaker. As I was saying, this is not new advice. The Advisory Committee provided the same advice 5 years ago. The former government, in their wisdom, decided not to follow it, and as a result, millions of patients paid twice as much for their medicines than they otherwise had to. Hundreds and hundreds and hundreds of millions of dollars paid out by patients because the former government decided not to follow the advice of the experts. Now, we are following the advice of the experts. It will halve the cost of medicines for 6 million patients, which is why the Consumers Health Forum has supported our decision. The Heart Foundation, Diabetes Australia, Arthritis Australia, the Breast Cancer Network, every other patient group that has reported on this has supported our decision. It will halve the number of times those 6 million patients have to visit the GP, freeing up millions of GP visits every year that can go to other patients who are currently waiting to see their doctor, which is why every single doctors group had supported it. Now, I've said that every dollar saved by the Commonwealth from this measure will be reinvested into pharmacy, because on this side we support sustainable community pharmacy. And we are talking with all groups in the pharmacy sector, including the Pharmacy Guild, about the best way to make that investment, including, in particular, the impact on rural pharmacies. And I look forward to those discussions continuing.